not all piles require surgery. So people are worried about surgery. People are worried about pain after surgery. People are worried about some incisions put on their delicate part. And patients are worried about post-operative, like after surgery care in that area. And most important, they are worried about if this problem happens again. And even if this doesn't happen, if they develop incontinence, like if they lose control over their fecal matter. So that is the main concerns of the patients who develop piles. So here we are with the newer and advanced technology for the management of piles. So to understand again what are the different grades of piles. So what are piles? Piles are basically enlargement of the cushions given by the god in the anal area to control the flatus and fecal matter so that that anal area won't open up without the knowledge of the person. So here to avoid that incontinence, that is losing the control over the fecal matter, we are not touching these pile masses, we are not cutting these pile masses, but we are just making these pile masses to shrink. So if we take grade 1 pile mass, these people most of the time don't require surgery and they can settle down with some medicines and dietary modifications. So if patient presents with grade 2 piles, these piles also can be sometimes managed without surgery, and they can be managed with some medicines and dietary modifications and lifestyle modifications. So here I would like to say, if you have early symptoms, if you have complaints in the anal area which are in the early stage, don't be afraid to go to the surgeon. Go to the right doctor, go to the proper, well-trained and qualified doctor. Don't go to the quacks. You can get mistreated, ill-treated. So don't be afraid. Here we are with the new advanced technology where we are making you comfortable after surgery. And with what? With a new technology called as laser technology. So if the patient is having piles of grade 2 and they are symptomatic, they are bleeding, and there are multiple piles of grade 2, we are going to treat with these piles with the help of laser. So what does laser do? Laser doesn't take out, we don't take out those piles, but we make those piles shrink and go back to its original position with the help of laser. So after laser surgery, there are no cuts, there are no wounds, and patient has little discomfort and not such severe pain. And since we are not cutting those piles, the patient will not land up into any form of incontinence. Now this is about grade 2 piles. If the piles are grade 3 and grade 4, so if it is early stage of piles grade 3, we can manage it with the laser. If it is grade 4 piles, then the pathology is something different. And for these piles, the reason is the anal mucosa which is supporting the piles has got loosened up, and that is why these piles are hanging down. And here in these grade 4 piles, we don't need to cut these piles, or we cannot use laser also. And then here we are using something called as stapler for fixing those piles to its own position. So here in stapler surgery, again we are not touching any pile mass. On the contrary, we are going above the pile mass and taking out some strip of mucosa above the pile mass so that the piles which are hanging down goes back to its own position. And this improves constipation also of the patient to much better extent. And in this surgery also, patient don't get, if properly performed, patient don't get any form of complication. And this has to be done with a qualified person who is trained, who is quite expert in this management of these stapler surgeries. And after this surgery, then patient will not have any type of incontinence, any type of recurrence, or bleeding or pain after surgery. So these are the newer technology for different kinds of management of different grades of piles.